This week in Grace's Girls Club, we're welcoming in a doctor from a field we haven't had before, dentistry. I want you to meet Dr. Tiffany Dean. Tiffany, thank you so much for being here. Please introduce yourself and tell us a little bit about the company you work for.
Awesome. Well, thank you for having me, Grace. I really appreciate this today. I am Tiffany Dean. I am a general dentist here in Madison, Alabama. My partner and I, Dr. Christina Congo, met in dental school, and 12 years ago, we opened our practice here in Madison, Eastview Family Dentistry.
Absolutely wonderful. And I'm going to keep that in mind, by the way. So walk me through your job and your day to day. You know, we all go to the dentist and we see you for a couple of minutes, but I know there's so much more to it than that. Walk me through what your day to day looks like.
Absolutely. And so you're exactly right. The majority of our patients come in and they see the hygienist, they're getting their teeth cleaned, then they see the dentist for a few minutes to check for cavities or gum disease, etc. And then that's what the majority of patients see. But then also too, that's about half of my dealings with my patients. The other half are getting fillings or crowns, or we're seeing patients for emergencies, maybe pain, infection, etc., on the other side of my office. And so that's my patient dealings. But because Dr. Congo and myself are the owners of the practice, we also spend quite a bit a day just managing a business, just like a small business anywhere. That's how I spend my day: management, patient care, etc. That's my typical day here at the office.
So I'm actually really glad you brought that up because I wanted to touch on that. Do you have a full patient load while also full-time managing the company? I mean, that feels like a lot to handle.
Well, very thankfully, we have a fantastic team here, and we have a wonderful office manager, and she handles a lot during the day. But the ultimate decisions for the business do fall on myself and Christina. And so, yes, we are handling it all at one time. But we're used to that. Dentistry is very busy. We are used to a fast pace. We are used to being able to make quick decisions either on the business side or on the patient side. We're just kind of used to it. On top of all of that, we're mamas. And so we are used to having to handle a lot of things being thrown at us at one time.
You go, girl. I love it. And we talk about this all the time in Grace's Girls Club. Men are wonderful. You know, I definitely cannot discount how great so many men are at their jobs, but women have such a unique ability to multitask at such a high level. It always impresses me.
Very much so. We are definite multitaskers here at as general dentists and here at our office in particular, for sure.
So of the letters in STEM, science, technology, engineering, and math, which of those do you feel is most applicable to your job?
Absolutely every one of them. I mean, as you can imagine, the science is a big part of our profession. Obviously, the microbiology, the biochemistry of dentistry, definitely. So the science is a big deal. But in my particular office, technology really plays a huge role. We obviously have the standards. We use the computers for our patient charting, the standards. We also have digital radiography, which means we take our x-rays digitally. But in my office, we make our crowns in the same day. And so we have basically a digital scanner, and then we have a mill and a furnace. And so we are able to make a crown for a patient within one appointment. And so that is a technology that is a game changer for us and for our patients. And so that is something that we utilize every day here in our office. There are also three-dimensional x-ray machines. There's new technology that incorporates say decay detection using artificial intelligence. And so there's a lot of technology that is currently in use in dentistry, but is always evolving. We also have to use a lot of engineering in our profession. We have to decide which materials are going to work best under which just the particular application we're going to use. And so then, obviously, there's a lot of mathematics that went into the fabrication and the development of the technology that we use. Also, too, just on a very basic level, I mean, we use math every day in my practice because most people here are they're dependent on their insurance, and so we're constantly having to run how much insurance they have left and running the mathematics on that. But what I really like about my particular profession is that we also incorporate STEAM into my profession. Art is a huge part of what I do every day. So I get to enjoy the STEM, but then I also get to use the artistic part of my passion. And so when I am working on a patient and creating a filling or a crown, then I also have to we want to make that also a cosmetic procedure too. And so I get to incorporate art into dentistry. And that's one of the things that I really love about this profession.
Okay, that is so cool. I was tracking with you on science and technology. I did not know even that it was possible to make your own crowns in-house. That is incredibly cool. But the art, the engineering, and the math, I never would have guessed, but it makes complete sense as soon as I heard you say it. Girl, I should have had you on months ago.
No, it's just really why I love my profession. I really do. I can use that analytical side of my brain, but I also really get to use the art. I really do have a passion for this profession. I really do.
That is so wonderful. And I like that it appeals to so many different components. A lot of times I feel like when we're talking about STEM, the medical field as a whole can be overlooked. But I also know that dental school itself can be very grueling and difficult. And so it's hard for some people to, want to do that. But hearing all the ways that you can incorporate STEM and STEAM, I'm hopeful that that's going to encourage people to take that extra step and go to dental school, because it sounds like you have an unbelievably cool profession.
I do. I really do. I'm very blessed. Absolutely.
Wonderful. So speaking of, kind of touched on it a second ago, but walk me through the type of schooling that you went through, excuse me, to get to where you are today.
So I have a Bachelor of Science degree from Auburn University, and then that was a 4-year degree. And then I attended the University of Alabama at Birmingham, UAB, and I have a Doctor of Medical Dentistry degree, which is a DMD degree, and that was also a 4-year program.
And why exactly did you choose this field? You might have feel like you already answered that with our last conversation, but is there anything else on maybe on the personal side of it, aside from just the academic, that really drew you to this field?
Oh, absolutely. So when I was in high school, I participated in a work study program, and so I thought that engineering would be more fit for my I guess my passion and my abilities. But after working for a year as a junior in a civil engineering firm, I realized that sitting at a computer in a cubicle all day was definitely not for me. And so then, as I needed a work study program my senior year, I had a fantastic mentor, Dr. Mark Kingery, who was my orthodontist in Montgomery. And he really encouraged me to consider being an orthodontist or being in dentistry. And I really did not think that that was for me. But after spending the year with him in the afternoons, I worked Mondays and Thursdays for 2 hours a day. I realized that really dentistry did kind of incorporate everything that I wanted. I was able to work with people one on one. I was able to use those STEM attributes that I could definitely embody. And then it just was a really perfect fusion for me. Dentistry was. So that's how I kind of fell into it with my work study program and as a senior in high school.
And that so speaks to how important it is to dip your toe in whatever you're considering vocationally before you get there. I mean, you had the benefit, you found this out in high school. Had you have found that out in a co-op your senior year of college, things might have been a little bit different. So it's great that you got that exposure early on in your career.
Absolutely. No, that's the truth. But I'll be honest, when I worked with him my senior year, I was overwhelmed by the thought of going to 4 years of college and then 4 years of dental school.
Mm.
And so it really took me until about my junior year of college to realize this really is a good profession for me. And so even though I had had that experience and I felt like that was probably a good direction for me, it is a daunting task to go to school for that long. But now looking back on it, it was really just a blip. 8 years really goes by quickly.
It's so true. The days are long, but the months and the years are short. So,
Absolutely.
Tiffany, walk me through the best part of your job.
I mean, the best part would definitely be for me personally. I love the personal relationships that I do gain with my patients. They really do almost become my family. I've treated them, a lot of them, since I've been in North Alabama. 15 years. I've treated them. Now I treat maybe their parents who have moved back to the area. I treat their children. And so I have multi generations of patients. I really do enjoy that part of my profession and that part of my day. I'll also say too that I also enjoy just being able to put that smile on somebody's face. Maybe they were in pain and I was able to address the pain. Maybe it was a cosmetic issue that they did not like that I was able to address. So really just being able to give that person either happiness, joy, or even just self confidence. There's a lot of times that restoring a smile can give somebody confidence, and I absolutely love being able to add to somebody's just their self esteem. And that is something that I can visualize on a day to day basis. And I really do enjoy that about my day for sure.
Absolutely. And, I can speak to exactly how right you are about how your smile does impact your confidence. So, in TV, when we're learning to be on camera, there's plenty of classes we take, and they always tell you if you smile and if you come off authoritative, you always look more confident. And when you show your teeth, that tends to
Absolutely.
be a thing. Well, I had a lot of friends that all of a sudden, our junior and senior year of high school, went and got Invisalign or started going to the dentist more, whatever it may have
Right.
been, because now that we're showing that off, it was something we had to pay more attention to. And I couldn't agree more with you that that did aid in a lot of self-esteem gaining in each of their cases, as well as my own.
That's right. And that's what really spoke to me when I was in high school, seeing the transformation with the orthodontics, the transformation from some of these, especially the girls who had very low self confidence and almost embarrassment over their smile, just seeing a complete 180 after getting that smile. I just thoroughly enjoyed watching that teenager blossom as a result of that. I enjoyed that, and that really was very fulfilling for me.
I bet it is. Now, I will confess, I do have one friend who is a dentist in Nashville, and every time I go out to lunch with her, I always go like this and cover my mouth because she just stares at my teeth, and I'll say, Lydia, stop staring at my mouth.
We really don't do that. I know everybody thinks we do, but we really don't. I don't do that, except my children. Now, I am looking at their mouth, but for my friends, I really don't do that.
Well, she could take a lesson from your book then. Maybe I should connect you two. So we spoke about the best part of your job. Tiffany, walk me through what maybe the most challenging part of your job is.
Well, as you can imagine, there are a lot of people who have a lot of true anxiety about coming to the dentist. And so, really, it is not the dentistry itself that's the biggest challenge. It really is facing patients' fears and their anxiety to even just coming into the office. It is very daunting for those patients. And so that can be a challenge for sure, as just to gain the confidence that we need in order to treat the patient safely and effectively. That's a big challenge for my day. Another challenge is just very realistically, I mean, again, going back to insurance, trying to get the patients the treatment that they really need, but convincing the insurance that they need to cover that, that is a very big challenge, a very big frustration that the patients sometimes are not able to get what they need or to the level they need simply based on the insurance company's discretion. And so that's a challenge that we have as well.
I can imagine. Well, I'm glad that your patients have you there to advocate for them.
We definitely do. We spend a lot of time advocating, writing letters. Part of our technology is we have intraoral cameras, and so we take pictures. A lot of times, a photograph, as we know, a picture's worth 1,000 words. And so we use that a lot of times, not only to educate our patients, but to show the insurance company how severe these situations really are. And so we do everything we can to advocate for our patients.
Well, you sound like a fabulous doctor. And I do want to let you go. I know you probably have patients just waiting for you. But before I do, one last question. Do you have a message to young girls or young students who want to join the STEM force one day?
Absolutely. Just as I had mentioned previously, I worked in a profession that I really figured out was not for me, or at least that form of engineering was not for me. And so I really feel like every opportunity is a chance to learn, even if you feel like you don't have anything to gain from that experience, you definitely have a lot to gain. And honestly, you may even recognize there's more to that profession than you thought. That's what happened with me. I found that I wasn't in for civil engineering and I wasn't particularly excited about dentistry. But then as I got into the dentistry experience, I learned that there really was a lot more to that. So I would just say, try everything, every opportunity that you have, just grab it, give it a chance, and then seek those. If there is a profession that you're interested in, you would really be surprised at how many people want to help inspire the next generation. And so if you know that there is a profession that is maybe drawing you, go try to find someone who will mentor you in that profession. We really want to inspire the next generations to take up where we will leave behind and make it even better. So I would just continue on, seek those opportunities. If it's financial that's an issue, there are lots of there's student aid, financial aid, scholarships. So just look around. There's more opportunities than you think out there. Don't give up. That's my goal.
Absolutely. Wise words and very encouraging words, to say the least. Well, Dr. Tiffany Dean from Eastview Dentistry, thank you so much for your time today. Thank you for sharing your expertise with us.
Well, thank you so much for having me. I appreciate that you have this available for the next generations. That's awesome, Grace. Thank you.
Well, it is surely my honor. I hope you have a great day today, and thank you so much for joining us. Welcome officially to Grace's Girls Club.
Thank you. Thank you. You have a great day as well.